Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost women's health services in the Seattle area, regardless of income or insurance status. 3W does not profit off of the health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always talk to or consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO of WAMS/3W Medical for Women, and the host of today's podcast. Hi there, Wellness Wednesday listeners. This is yours truly, Helen Nguyen, back in the studio. You know, the podcast, Wellness Wednesday, has been, I think we're coming up to 3 years old. And it's always been this daunting thing that I thought, why are we doing this? And in the beginning, I did not have, I want to feel like a handle on it because I was very scripted. And I was always like, how are we going to get these guest speakers in here? And today I get the honor of sitting across someone not only that has beauty, but brains. It is the beautiful Miss Aishy Kumar, who's Miss Central Washington. And are you competing for Miss America right now? Or?
Yeah, I'm competing for Miss World America.
Oh my goodness. And all of that. She's going to tell us her beautiful story. But I feel so lucky to sit across from you today.
I feel lucky to be here.
Because just interacting with her just for a little bit, she has this beautiful story that she's going to tell all of us. But also, I feel your heart, like your heart for this work that we're doing here in the heart of Seattle. But I feel your heart for people. And that is a genuine, authenticness that I feel from you. And I hope that you go far in this pageantry world so that others can feel your heart. So thank you so much for being here. Thank you so much for giving our tiny little podcast a chance and sharing your story. And what you see on camera is true, guys. Like, she is gorgeous in person as well. So, Ash, what is on your heart? Well, first of all, let's get to know you a little bit more, but what's on your heart to speak to us about today?
So I wanted to tell you my story.
Yes, yeah.
Which is a story of resilience.
Yes.
And strength. Mm-hmm. And compassion, most importantly.
Yeah.
And I would like to talk to everyone about just the knowledge that they need to have for their own health care.
Yeah.
And that patient advocacy is not just, let me help you with your medical bills. But it's life or death in some cases. It really is.
Yeah. And so give us a little bit of background. You talked to me right before we started recording about your family history, how you guys came here. Could you tell our listeners a little bit about that?
Yes. So I was born in Fiji. My whole family was born in Fiji.
Okay.
And we came over here through the green card lottery.
Okay.
My mom won it. She was one of those lucky people.
That's so crazy.
I know.
You hear about it and then that's crazy. Yeah.
I know. And yeah, so she won it. So we came over here to Washington because she knew, the only person she knew here in America was an uncle who lived here in Seattle. Okay. So we came over here and yeah, we had a very humble beginning. My parents worked all the time, very hard, and they worked in healthcare. In Fiji, they were police officers, but here...
That's so badass.
I know.
That's so cool.
Yeah, so they were super strict.
Okay, yeah.
Very disciplined, and very by the book too. That gives you a good premise on kind of what my mom was like. Very by the book and strategic. And so my parents worked very hard when we came over here. It was just them. They were in their 30s and they had 2 little kids, myself and my brother. And they worked really hard to give us everything. Yeah, that they could.
Oh, wonderful. And you guys have been here for 20 years, you mentioned.
Yes.
And how have you liked it so far?
It's lovely. I wouldn't live anywhere else, to be honest. Seattle is my home, in my heart. Yeah. I can't imagine living anywhere else.
Okay.
It really is, yeah.
Yeah. How old were you when you guys came?
I was 4 years old.
Wow. Okay. So super young.
Yes.
Yes. Super young. Okay. And
a little bit more about your background. Where did you go to school around here? Like, how deep are your roots, I guess, here?
Yeah. Well, so, I mean, I did all my schooling here in Seattle.
Okay.
At the age of 18, I became a medical assistant because just healthcare was really important to me from a young age. And I wanted to make a difference in people's lives. And the way that I saw that I could do that was through healthcare. So at the age of 18, I enrolled in the medical assisting program because I just wanted to get started immediately.
Right.
I wanted to study and become a doctor.
Okay.
And so I wanted to get my foot in the door. So yeah, I started really young in healthcare. And I started in neurology.
Okay.
Where I then transferred to geriatric medicine, so 65 and older.
Okay.
And it was the first geriatric clinic that they created in the clinic that I was working in. So it was the first geriatric department. So at the age of 21, I had the job of me and another medical assistant and like our small little team, just like the four of us.
Yeah.
We had the job of basically establishing this department from the ground up. Protocols, training, just everything from the ground up, patient care, how we would do the rooming, how the chart notes would look like, what kind of questions we would ask. Because when patients are 65 and older, their needs are drastically different as we're focusing on end-of-life care. So you think about death a lot. And one thing I learned from working there and developing that clinic was that about compassion, like serious compassion towards patients. Some of the patients that we saw, sometimes the only reason that they came there was just to talk to us.
Oh my gosh.
I know. Or the only interaction they would have that day was just seeing us, you know, just talking to us, seeing us. They would live in nursing facilities, and some people don't have anyone to come visit them. Some people don't have any family. Some people, they're just by themselves. And your healthcare staff is sometimes the only people you see when you're in that position.
Oh my gosh. That just like literally breaks my heart.
I know.
Right? Like, because everybody needs, like, we're not an island. Like, we don't function as individuals within an island. And I'm a Seattle native as well. And sometimes I feel I've traveled quite a bit, and sometimes I go to the South and I'm envious of their sense of community, because even though we have community here, it's still very isolating. It's not as warm. It's not as inviting. And that maybe that's just the vibe out here, and that's kind of, it is what it is, but there's this true sense of isolation out here. And so how has that shaped you as a person, being exposed to that type of heartbreak from an early age? And how has that motivated you to enter the healthcare, profession with a different outlook?
Yeah, I think number one, it matured me drastically. I think at the age of 21, you're pretty mature in general, but when you're dealing with end-of-life care, you start looking at life and people much differently, and you kind of start seeing people like as a more, and patients too, as a more fragile soul than just, diagnoses, execution, and then out the door, right? It's more like, it really is more about compassion and what kind of warmth that you can bring to someone when sometimes people are so distraught in the clinic, and you probably see that too. People are nervous, they're anxious, they're depressed sometimes, they don't know what's going on, they're so worried, and like the least you could do that has the most amount of impact would be just to say, hey, like, I'm here for you, we're here for you, and we're here to listen to you.
And how has that shaped your path into healthcare? Like, I forgot to ask you how old you were.
I'm 25 right now.
You're 25. Okay. You're still fairly young, and very young. And what are you hoping, now that you're given this platform, right, to speak to a very different kind of world, the pageantry world, what is your message for that greater audience of healthcare, and what real compassionate healthcare looks like?
That's a great question. My message would be that, like, number one, of patient advocacy based on my own story. I would say that it's very important, even for yourself and for older patients as well. You want to make sure that you're not going into the doctor's office by yourself. It's always a good idea to go with someone. If you feel like something is wrong or you're not being heard, it's always good to get a second opinion. And I just want everyone to realize that healthcare is not just, I'm going to go to the doctor and, I'm going to get some medicine and then I'm going to go. It really is a full emotion that's invested into the practice. It really is, from all of the staff.
Our medical staff here have very much adopted we don't want to be called providers. We want to be called clinicians. Providers give off this subconscious context that we are just like drug dealers. You come in, you get a prescription, and then out the door you go. And here at 3W, we try our best to be collaborative. We try to look at you as a whole person. So we always say we do our best way of practicing medicine in the way of holistic care, right? So you bring with you, yes, that medical issue that you need to be addressed, but you bring with you your values, your spirituality, your religion, your culture, language, like all these things that shape a person the way they are. And every single person's so unique, right? Yeah. So there's no type of cookie cutter type of healthcare that happens here. I want to say that with a lot of reassurance to people, because I think women especially deserve that type of attention. And it sounds like within your story, which I would love for you to share with us, like how was there intentionality within your experience? And if there wasn't, how did you go after it? So yeah, just want to give you that platform right now to tell your story.
So I'll kind of set the scene for you.
Yes, please.
So, at the age of 8 years old, I had come home from school. Okay. And I was just, winding down from the day. And all of a sudden, I felt just this sharp stabbing pain in my belly. Like 100 knives had just stabbed me, like completely to my belly. And I fell to the ground. Okay. And so my brother was the only one home. My parents were working. And so he was like, oh my God. So he called my parents. They came home. Luckily, they were already on their way home. Okay. They called my pediatrician and we made an appointment for the next day. So I go into the clinic the next day. They do blood draw and everything's fine. Like they say everything is fine. And my mom's like, okay, this is weird, but okay. So I go back home and I continue to get sicker and things just keep getting worse. So my mom calls the doctor's office again. She's like, hey, her stomach is hurting. She's not eating. She's having all of these symptoms. Like last time you guys said, nothing was wrong, but she's getting worse. So they had me come back in. We did ultrasounds. We did more testing. And they found fluid in my abdomen with the ultrasound, but they said that it was because of diarrhea and that I was having rotavirus, which at 8 years old, you don't get rotavirus. Rotavirus is something that occurs in babies.
Okay. Yeah.
Yeah. So my mom's like, that's not right. She's 8 years old. She can't have rotavirus. They're like, no, it's rotavirus. It'll subside in 2 weeks. You're fine.
That's so weird.
Yeah.
Okay. All right.
So I go back home and I just every day it just keeps getting worse. The skin on my abdomen was green and then it became black.
Oh my gosh.
Yeah. And I couldn't eat.
Oh my gosh.
And my mom just could tell something wasn't right. And she kept calling them all the time. And they just kept saying, just wait 2 weeks. It's rotavirus. It'll pass. And my mom's like, no, this doesn't feel right. And 2 weeks pass and I'm not getting better. I'm only getting worse.
Wow.
So she finally calls Children's Hospital. And she tells them my symptoms and they're like, no, she needs to come in. And the night that she called, they told her there's just too many cases tonight. Come early tomorrow morning, 6 a.m. So mom was like, okay. So my parents bring me 6 a.m. to Children's Hospital. They do all the diagnostic testing and they're like, she has sepsis. Yeah.
Oh my gosh.
So my appendix, so what had happened was that my appendix burst inside of my body and stayed there.
Oh my gosh.
And I had sepsis and I became septic.
Oh my gosh.
Yeah.
Why didn't they catch that?
I have no idea, right?
Wow.
And you think about it, like we were talking about women, right? And being immigrant women, right? my mom, she's a brown woman, and luckily, like, we come from a country that speaks English, but imagine, like, if she didn't know anything.
Right.
So,
or stopped advocating for you.
or stopped advocating for me. Yeah. Like, imagine if she was just like, okay, like, the doctor knows best, which usually they do.
Right. Yeah.
But if she didn't trust her gut, you know, I wouldn't be here today.
Wow. So what happened? Like, so they diagnosed you with sepsis, and what was how did they treat you, or how did they put you back together?
I know.
Yeah.
So
'cause that's serious.
Yes. Yeah. I mean, I was dying.
Yes, pretty much. Yeah.
So I was dying, and they knew that. But they couldn't, the issue was that the entire wall of my abdomen was lined with fluid and pus. They couldn't see anything. And when that happens, there's a huge danger in perforating the bowels, damaging an organ. And they needed to check if my organs were still okay, because it had just been that bad and had gone on for that long. So their first step was to remove this excess fluid inside of my body. They couldn't even touch the appendix at that time. Wow. So for 1 month, I was basically just bedridden. I could only be in bed. I couldn't eat for 1 month. So I had an NG tube. What? I had a feeding tube. I had a catheter.
Whoa.
Yeah. Yes.
Oh my gosh.
Yes.
Oh my gosh.
And I was just basically just in bed while they worked on clearing out all of the fluid.
Yeah.
And so 1 month that went on. And finally, when that was taken care of, it had gone on for so long that the appendix had begun to inflame again and was on the verge of rupturing again.
Wow.
Yes.
Oh my gosh.
So when I left I had to leave the hospital for after the month, just in between before surgery.
Yeah.
And I had it's just a drainage bag that was attached from the inside that went on the outside. And I had a PICC line in my arm as well. So I was like that for a little while I was still trying to go to school. Obviously, I was very skinny.
Whoa.
Yeah. Yes. So
That's
still trying to go to school. Still, like, at the time, like, I mean, I was just like, okay, like, whatever's happening, I just have to get through it.
Right. Yeah. And who was your parents' support system? Like, I mean, it sounds like they were both working, right? Trying to provide for you guys. Was there a support system for them?
Unfortunately not. So my dad had to continue working, and my mom left her work for a month, like, for that duration of time while I was in the hospital. And so she lived with me in the hospital. She never went home, like, not even once. Yeah.
That's so good.
And I have an older brother, and he was home by himself. At the time, he was, like, in middle school. So he was also very young, and he had to be home by himself too.
Yeah, a lot. Yeah. But that was the circumstances. And you guys, it sounds like you made it on the other side.
Yes.
Yeah, through a lot of perseverance. Yeah.
Yes.
In your 8-year-old brain, like, if you can remember those moments, I'm sure you can, but, like, what did you think you were dying? Did you think, like, what is this? Like, and how did you come out of it not being bitter? Right.
Yeah. Well, so I'll tell you.
Okay. Yeah.
So at the time, I mean, it makes me emotional to even talk about the surgeon who saved my life, because he doesn't know what he did for me. You know?
Yeah. Yeah.
So it had gotten once they drained my body of the excess fluid, and it was safe to go in. He told my mom. He told her that he did everything he could, but the rest, and this is his motion. He said the rest is up to him. So he basically said, I did everything I could. Now it's in God's hands to save her life.
Yeah. Yeah.
Yeah. It makes me emotional because it's so meaningful to me.
Yeah. Yeah.
It really is. And so that's why I'm not bitter, because the compassion I felt in that hospital, it changed my life.
Yeah. Oh.
I don't mean to cry. I'm just it's so meaningful to me.
It's beautiful because it's real, it's raw, and it's like your story. Like, no one can take that away, right? Yeah. Gosh, that must have been scary for your mom to hear.
She said she just prayed. Like, she just kept praying because she didn't know what else to do.
Right.
She said she prayed all night.
Yeah. Yeah. But you're here.
I'm
like,
here.
look,
I know.
like that surgeon did his part.
Yeah, he did.
And the rest. And so is this kind of what has fueled your passion for this type of care for others?
Definitely.
Yeah.
I know that like I can't do what he did.
Yeah.
But if I could in some small way change someone's life, you know, and just in some type of way make them feel a little bit better than they did before, like that means the world to me.
Yeah. Yeah, of course. Yeah. Sometimes I think there's this pressure to produce results, right? And then we forget the human part of the situation, right? Because we forget that one person then affects the next person, affects the next person. And there has to be more of a balance between healthcare, because you know how we just met and you don't know that much about 3W, but how 3W got started was we felt like there was or continuously a disservice for just people in our very rich city. Like there is so many resources here, but unless you know how to advocate for yourself, unless you meet that right medical provider, right clinician who truly sees you as the whole person, it's very transactional. It's very like billings is involved and it's 15 minutes in and out, and there's not this human connection. And I get it. There has to be when you have a good product, you want to get people through the door to experience that. But then in the grand scheme of things, I think medicine has lost that sense of compassion of, yes, we need to reach a lot of people, but we also need to slow down and focus on that person that's truly in a dire situation or really in need of that human compassion. And there has to be a balance between the two. And I think sometimes for our donors, you know, we have amazing donors and supporters. And I think I sometimes have to walk this fine line of, yes, we want to see more and more patients, but there also needs to be this middle ground of I need to give quality care to the person sitting in front of me too. Like it can't be this like rushed process, because I have to honor that person's presence and why they walked into our clinic. I have to honor that sense of, oh, they're here because they're trusting me, just even from a website.
Yeah.
Right? So where are you now? You know, and why is telling your story so important to you, to others? And how are you hoping that the pageantry world can, you know, elevate your story in a sense of impacting more people?
Yeah. So I called my platform Empowering Lives Through Compassionate Care because, yes, my story is based in healthcare, and my whole life has been dedicated to giving compassionate care to patients and trying to make a difference just in anyone's life, really. Any patient that walks through the door, I just want them to feel heard. And I don't think that stops in healthcare either. This carries throughout my entire life, through friendships, family, or anyone that you meet. I think it's very important to prioritize just love and like compassion in just are the words we say, like the actions we do. We don't know like how, like what we do impacts others. I have a very strong memory from when I was in the hospital. And so when I was there, just kind of sitting, and by this point I had gone through another surgery and I was able to eat again. And so there would be this snack guy, like he would come to all the rooms, to all the kids, and he would have like this little like cart of snacks, like Rice Krispies and chocolate.
His role is very important.
Very important.
Yes.
And that day I was there all by myself. I think my mom had an appointment. And this was a very small, he probably doesn't even think about it today, but he came into my room He was like, hi. He was like, oh, you're by yourself today? I was like, yeah. And he gave me a Rice Krispie treat, and he was like, you know what? He's like, I'll give you 2. Usually they only give you 1. And he gave me another one, and he didn't have to do that, right? But I think about it even today, and I'm 25.
That is so sweet.
Yeah. And so it's these little things that really make our life richer and fuller, like what we can do for other people. And that's what my platform is about. It's just about compassion, not only in healthcare. Like, yeah, that's very important, but in all aspects of life. I just have like a small passion for modeling. I modeled through Seattle Models Guild, and even there, like, you're not just like sitting in front of the camera taking pictures. You have to make friends, you know, with the entire staff. Like, you want everyone to feel comfortable around you. You want the photographer to feel comfortable. Everything you do in life, whether it's healthcare or not, it all has to do with how we treat other people. But in terms of healthcare, one message I would like to focus on is patient advocacy. Like I was saying earlier, like with my mom, like being an immigrant woman, like lucky enough we come from a country that speaks English, but if she didn't have all of this under her belt, like imagine what would have happened to me. I would have just passed away in my bed at home.
Probably. Yeah.
So education is very important. Compassion is very important. And so patient advocacy and just empowering lives through compassion is what I really stand for and what I hope to bring to the Miss World America stage.
Yeah. And when is that happening? And what can we do to, like, you know, fangirl or like support you moving forward through that? Because when is that happening?
So the official date is November 17th. They've officially announced it.
Okay.
Yes.
Wow. That's like around
so
the corner.
Close. I know. And you're already supporting me by allowing me to be here and talk to you. Like, this is amazing. I'm so happy to be here.
Thank
and
you.
I think that your clinic is such an amazing thing. Like, it's what you're doing here is amazing. It really is.
Thank you.
I was telling you earlier, like, there's so many women that need this. Like, I was talking to a friend and I was telling her about it, and, you know, she needs to have something done, but she's been putting it off because she's like, oh, you know, what about the cost, or what about this and what about that? And I'm like, these guys are right here. She's like, oh my God, I didn't know.
Right.
So I would love to get and I know, like, yeah, you're already doing an incredible job.
Thank you.
So I'm just so happy to be here.
Thank you very much. Yeah, I like to say we're small but mighty. We're one of kind of a little secret out here in Seattle, which I hope to not be so secretive anymore. I mean, we're fairly new, right, as an organization, so I understand there's still a lot of credibility that needs to be earned in the community, but with the 7 years that we've been open and the lives that we've been able to touch and the lives that we've been able to encounter has been, you know, I think patients don't understand how much it changes the staff's lives.
Yeah.
Like, we get the privilege of sitting across from someone who's in a sense of brokenness or despair, or because we bring our whole selves. I think as women, it's very natural for us to bring into a space, not just isolating this one problem. We intuitively understand that our healthcare is connected to more than just that body part. And so I want to say wholeheartedly that our approach to healthcare is the whole you. You get to bring all of you, all of your baggage in that space, and we hold it with a lot of intentionality. And there's a freedom with that too, to be able to see you as not just one note, but many dimensions, and just this freedom to say, yes, this thing is hurting or is in pain, but it has impacted me mentally. It has impacted me socially. It has impacted me spiritually. And how do we even start to peel back that onion to even address this one thing when everything else is screaming at me? And I think we've done a fairly good job at welcoming you into a space that goes, okay, we're not gonna rush this. We're gonna peel back the layers one thing at a time and make the connections so that when you walk out, you feel that something has been addressed to then have a ripple effect to impact the next thing. And you're welcome back anytime. You can come back as many times as you want. We do not profit off of your healthcare decisions. we are here to simply serve. That's it. That's like no strings attached. Like that's it, right?
Yeah.
And that is something that has given back to our staff. And I'm one of the founders, and that has given back to me so much, right? So I'm sure, your story, I'm sure the people who have served you, it has impacted their lives too, regardless if they make those connections or vocalize it or not. Like the snack guy, he probably felt really happy to be able to give you that second Rice Krispies treat. Like it probably made his day to be able to do that for him. And it was so small.
I know. It means the world to me.
Yeah.
Yeah. And I feel the same way. Like, so currently I work in plastic surgery. Okay. Though it's different than end of life care, the message is still the same. Just like how you were saying, you still want people to feel like, like this is a safe place for me and I can come back anytime I want. I know that my needs are listened to here. Because oftentimes people think of plastic surgery as, this is just a superficial thing. But in reality, like we are dealing with deep psychological issues sometimes. It's your face.
I can totally see that.
Yeah. And you only get one.
Yeah.
So a lot of people, and you know what? They look beautiful. Like they look perfect, but they're like, it's just something deep within them. And as healthcare staff, we just kind of have to see that and be like, okay, let me take care of you how you need me to. Yeah.
So, thank you for saying that. So what do your parents think about you going into the pageantry world? Were they like, what? Or what is this? Or were they like, yes, this is awesome?
They've always been telling me to do something like this, to do pageantry.
Yeah.
And they're so excited right now. They're so ecstatic about it. They're so supportive. And they think like it's an amazing thing that I'm doing. I love the World Organization. It's an incredible humanitarian organization. It really is. It's not just a beauty pageant, but it's more than that, right? That's why we call it beauty with a purpose, because it's not just beautiful women, parading on stage, but we are trying to make an impact in the world through the things that we are doing. Yeah. And so my parents are so excited, and I never thought I would do pageantry, by the way.
Really?
Yeah, I never thought. I was very kind of like, I'm low key. Like I don't want to be out in the spotlight or talk about myself or like anything like that. I was always very uncomfortable to like share my stories. I don't know why, but I was. But and then that's just something as I've gotten older, I'm like, you know what? Like this is me. This is my story. And I'm going to share it, without any inhibitions or like any restrictions that I put on myself. Just being confident. Yeah.
And so where is the pageantry being held? And is it going to be like televised?
Yes.
Okay.
It will be televised, and it's at Embassy in SeaTac, like near SeaTac Airport.
Okay.
Yes.
Okay. And it's November
17th.
Yes. And how are you preparing for it? Give us a little glimpse into that.
So we're 2 months out, so it's very, very busy.
Yes, I'm sure it is.
So on top of like clinic work, on top of like modeling work, bookings, and keeping up with my portfolio, I'm also managing like practicing my walk. Like that's very important. And that is something I struggle with. So I'm trying to really work on that. So practicing my walk, practicing my interview, making sure that my message is clear. That like this is who I am and this is what I stand for. Making sure that I have all of my service work just all ordered and together and properly presented so that when the judges do look at my platform, they're like, okay, this is who she is, this is what she's done, and this is what she stands for, and this is why we choose her.
Wow. Okay. And how many are competing? Do you know?
I don't know the exact number.
Okay.
When I did speak to our director, she said that it's around 50, but I'm not sure the exact number.
Just in our state or?
Just altogether.
Altogether,
yes, nationally.
Okay. And so are you representing sorry, I'm ignorant about the pageantry world. Are you representing Miss Central Washington? That's your area?
Yes.
Okay.
Exactly.
Wonderful. And have you enjoyed pageantry?
Yeah, it's so fun, actually. I did my first pageant for Miss Washington USA.
Okay.
Like just in June. It was my first ever pageant that I've ever done in my life. And I was like, OMG, this is so fun. Like the women you meet there, they're all incredible, talented, beautiful. Like you just meet so many cool people. And it's so fun. It really is like a sisterhood that you just get to like, we're all in this together kind of feeling. And, you know, we worked hard for this and, you know, may the best one win basically. And it's just so supportive. And even in the World Organization, even more so that it's really a strong sisterhood and we have so much support and guidance. And I just think it's so fun. And the effort you put in really is worth it, in my opinion.
Yeah. So it's the opposite of what your typical person probably think about pageantry. Like there's this like competitive cattiness. No?
Not at all.
I mean, there's probably a healthy sense of competition, right?
Yeah, definitely.
But we think of pageantry and we think like, oh, there's people trying to like take people down. That's probably the opposite
Not at all.
of what you've experienced.
Yeah.
Okay.
Yeah, at least in my experience.
Yeah.
I think every girl I've met has been just wonderful. Like every single girl, like they're all wonderful and they all have such a strong message and they all are so powerful. They're all so capable and so confident. That it's inspiring to me.
Yeah. Yeah. So, how much time do you have to put into preparing for this competition that's coming up?
I mean, it's a full-time thing, like
Really?
hours. You're 24/7 thinking about interview questions, thinking about just making sure that like your talking points are correct, that you don't stumble or, you know, mispronounce or mutter, which is, you know, very easy to do.
Yeah, sure.
But one of the things I'm trying to learn is how to command an audience, right? I think that's a very important skill to have, especially in public speaking.
Yeah.
And that's another thing people don't think about pageantry, that it is very public speaking based.
Right.
And you need to be a good speaker. So I'm just working on my speech and like working on my talking etiquette and just, you know, trying to build the skills I can to be able to command a room. And that takes a lot of effort, like at least for me, like for someone like me. So that's a skill that I'm really trying to hone in on, and that's a 24-hour effort. And then you need to dedicate time, at least 1 to 2 hours per week for walking, like making sure that your walk is good, that you're, you know, you just want to be as prepared as possible. So it's really as many hours as you want to put in. And for me, that's countless hours.
Yeah. Is it, I mean, it obviously seems like something you enjoy doing. It doesn't seem like it's a burden or anything like that.
Not at all. Not at all.
Yeah. It sounds like it's really about honing in on your gifts and then being able to communicate it and tap into it to the max, right? Like in medicine, we talk a lot about practicing at the top of you want to practice at the top of your license.
Yeah.
So you're in the pageantry world, you're trying to like practice at the top of your gifts.
Yeah.
And communicate that not only through just your natural communication, but through your hair and the clothes that you wear, because all of that matters, right? In the grand scheme of things, that does matter.
Yes, it's our uniform.
Yes, and I remember something that Oprah said. You know, and Oprah said that she would not have gotten as far as she had without makeup. And this is Oprah, right? Yeah. She is confident, and she is like commands a room. You know, and all of that stuff. And even she has said, like, I needed makeup as a tool for me to be someone well received on television, someone well received in just the media community as someone that knows what she's talking about, right?
Yeah.
Because no matter what, like, we are attracted to a certain look and stuff like that. And I'm not saying that that's not always the right way of looking at someone who can communicate well, but it does help.
It does help.
Yeah.
Yeah.
It's a uniform.
Yeah,
it's a tool.
Is. Yeah, right? Because when you go to the doctor's office, you want your doctor to come out in a white coat, right?
Yeah.
You don't want him to come out in his pajamas.
Yeah.
Right?
Right. And well, we are so excited for you. We are definitely looking forward to what that whole day is going to look like for you, and know that our group out here is going to be rooting for you.
Oh my gosh. Thank you so much.
So, well, what is your your one nugget message that you would like to leave our listeners today?
I would love to tell them that any small action you make today has the power to impact someone's life forever. Forever. Any small thing you do, whether it's positive or negative, it's very important to remember that you could change the trajectory of someone's life by that action. And it really is that impactful. And then the second thing I would like to say for patients is about patient advocacy. Like when you go into the doctor's office, make sure like at least have some background knowledge on what your condition is, the type of things you need, your symptoms, just so you're not going in blind. Like that's very important for yourself.
Right.
And then if you feel like something is wrong, say something. Say something.
Please.
Please say something. Because this could be life or death. Like say something.
Right. Well, thank you so much for your time. I've so much enjoyed just getting to know you and getting to know your story. And we just wish you the best of luck. We can't wait to hear what the results are. I'm sure it will be glowing. So
thank you. Thank you so much for having me here. It really has been an honor to be able to sit down and talk to you.
Wonderful.
And share our stories together.
Yes.
It really is so wonderful.
Wonderful. Thank you. Well, there you go, listeners. Go out and root for Miss Aishy Kumar, who will be competing, and wish her the best of luck. Send her good vibes, guys. She probably doesn't. She looks great. And will be kick butt, but send her all those good energy and vibes so that she can win for Miss Central Washington. So
Thank you.
Yep. Thank you, everyone.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.